Good morning, everyone. I have come out with yet another slides, and this is called Combating COVID-19 and Committing to Christ. So this will be a little academic kind of sharing also initially, but there will be later part of the sharing will be my personal experience, how I suffered from COVID and how I came out with it. And there are many people who have been asking me how to combat it. So this is the slide which talks about a little detailing of the virus. So COVID-19, it stands for coronavirus disease, which came in 2019, and this is also called the novel coronavirus disease actually, and the family is Coronaviridae, and it is in the RNA, so it is called RNA genome. And as per the crown, the structure or anatomy of the virus, there are crown-like, there are the spikes which are like crowns on the surface of the virus, and based on that, like the scientists have categorized coronavirus into 4 main groups. So that is alpha, beta, gamma, and delta. But based on that also further, there are different types of viruses actually. The common coronavirus is 229E, which is an alpha category, which comes under alpha category. NL63, which is again the alpha category. OC43, which is in the beta category. HKU1, which is in beta category. And other coronaviruses are MERS coronavirus, which is beta, SARS coronavirus, which is again beta, and SARS coronavirus 2, which is beta, which is also known as 2019 N coronavirus. And this is the last one which is actually affecting us, and we see like people become very sick, and they are really severe in their sickness. So this coronavirus again has many strains, and we see that SARS coronavirus 2, which is causing this COVID-19 pandemic, which stands for severe acute respiratory syndrome, or sometimes it is also called SARDS, which is severe acute respiratory distress syndrome. So we see there is the strains which is L type, which was first found in Wuhan in December 2019, and gradually this strain vanished, it disappeared. And then this L substrains gave rise to S substrains, and that was seen in early January 2020. And then in mid 2020, there was another strain of virus which is called V. And then in mid January, again we saw another strain which is G coming up, especially in Europe, Italy, and then it widespread all over. The G strain of the virus get mutated, and it became GR and GH, which was also seen in February 2020. There are many substrains, at least 11 of those, and those are like O, A2, A2A, A3, B, B1, etc. And recently in India, in Telangana, they discovered A3I or A2A. So there are many strains actually, but at least 11 are very confidently identified. So if we see the world meter, of course I wanted to just put it the latest, this is 2 days back data. Before the sharing I just forgot it, but then you can see that this is a pandemic which has affected more than 215 countries, and the total global cases, I can still find it anyway, are like, you see the figures, it is in crores actually, and then that is 31071,628. This was the day before yesterday's data, so today it must have gone even higher. And then the total global deaths were 96, what is this, one sec, 9,62,688. And India also, we see like 2 days back, the total number of cases were 54,18,681, and the total deaths were 86,926. Probably right now, like it is nearing 90,000 deaths. And these are all the data or the figures which have been reported. There may be many more cases which are not reported. So the daily approximately rise or in India is about 90,000. It was we were thinking like it will cross 1 lakh the reported cases, but somehow like it is around 90,000. So there can be various reasons, and I'm not going to go into those details. And most likely it might be over 1 million case per day. That is like in days to come. They say like in January it will be peak. 1 million is 10 lakhs. So that is the scenario of the infection and transmission of coronavirus. So if you see this increasing cases of COVID-19, it's very alarming. First case was detected in India on 30th of January in Kerala. And in 8 months today, we saw that it is 54,18,681 as per the data which was there day before yesterday. And we see that the community transmission is happening. And if we see retrospectively, looking back into the history about all the pandemics and plagues, at least like few we can see it here itself. And the plague of Galen, which was in 165 AD, which actually went up to 189 AD. But then these 165 AD, 67, 68 were the peak and all that, and again it came back in 89. So in that period, about 5 million deaths happened. 5 million means like 50 lakhs deaths happened. And each day in Rome, there were about 2,000 people dying each day in Rome. And then there was a plague or the pandemic of a plague of Cyprian, and it was in 249 AD to 262 AD. And this time, like again, the deaths were enormous, and each day in Rome, about 5,000 people were dying. And the more recent one in the past history is the Spanish flu of 1918, which lasted till 1920 for about 2 years. And 500 million people were affected. So, you know, like what I'm saying. And then there were 50 million deaths, means about 5 crores. So 50 million deaths had happened in just recent history, probably just 100 years back actually. And presently, if you see what's the condition, how the transmission is happening, it's in the community transmission, and the source of infection is untraceable. You cannot trace like where somebody got this infection, COVID-19, because people are moving around, and they come across so many people. They are all like apparently good looking without any disease and all that. So marketplace and families and this and that, whatever. So infected person actually never traveled, if you see. So, and of course we also know now nobody is traveling for last 6-8 months and all that. And we see that. And then the spread is extremely contagious. It is infectious, and it is difficult to control. Even now, like, it is difficult to control. I see, I'm there in Ranchi, and I see like how many people have been affected, and in last about 70 days or so, I personally know about 40 deaths, over 40 deaths. And now the fear is that we will soon enter stage 4 of the disease phase, which is practically impossible to control. It is uncontrollable, and major cluster of infections will be seen in the crowd or in the population, and deaths will be on a much rise. So this is definitely a chaos, crisis, and a concern for all of us. And the question which comes, which even people keep on asking me, so how long and when will this pandemic end? It's a very genuine questions, and everyone, even the medical professionals and laymen, everybody has this question in mind, that how long and when. And we need to continue to take some active measures, which is like have appropriate mouth and nose mask. And when I say appropriate, like it is covered well, the layers are good. N95 is one, of course, but there are like other, which is 3 layered or 5 layered, sometimes 7 layered masks. And that is very important. It's not the handkerchief that you tie around, or the gamcha, the towel kind of thing, the thin cloth that you just wrap around. That is important, but a proper appropriate mask is very important. And then the hand hygiene has to be there, and the best washing is with lots of soap and water. They have been advertising also in TV that at least 20 seconds of hand wash. And of course you have like the sanitizers where you sanitize yourself, and that is good. Where you can't do actually repeatedly hand wash with soap and water, sanitizers play a role. But if you compare the effectiveness of both the washing, then definitely soap washing is much better than mere sanitizing your hands. And physical distancing is very important, so one needs to have physical distance. Even in the family living in the same house, if we can have a like sit around with a distance of about 1 meter and all that, that helps actually. And however, all these measures that I shared right now will only slow down the transmission, which is very important, because we are slowing down the transmission at the same time waiting for something concrete to happen, the herd immunity to come into the community by vaccines and many other things. So we'll come back to this herd immunity later in my sharing. But this contact tracing was important. Isolation and quarantine of the person affected, asymptomatic or symptomatic, is very important. Or somebody who is already affected because of the exposure, may not be symptomatic, has to be like isolated and all that. There are certain tests which has to be done to confirm the thing, and symptomatic treatment has to be given. A support system has to be there with family members, friends, government, and many others. And these are crucial to save lives and minimize disruption. But what is the long-term solution? We don't know, because as we saw that the pandemic or the plagues, they lasted for 2 years or more. Even COVID-19 is not going to end up now in few months. It will be there for a couple of years actually. So the assumed solution is herd immunity. Now, how do we achieve that? We see that we achieve that by vaccination and by exposing ourselves to the disease, and at least like 60% of the population has to be infected, and the community transmission and infection in the community has to happen, so that I get from somebody or other, then I pass it on to somebody and all that. and at least 60% of the population has to be infected. If not by natural way of disease transmission, then definitely by the artificial methods, which are the vaccines. No? So infected through the, they have to be infected through the vaccines. And 60%, if it is so, that means now say like Indian population is roughly 130 crores. So even if I, for the calculation which is easy, I just negate those figures and I take it 100 crores. So 100 crores means 60 crores of population has to be infected naturally by the disease or through vaccines. That's one big challenge, 60 crores. And then like we know the percentages that 70% of the population will be like asymptomatic, or 50%, if suppose there are 100 people affected, means say like 100 crores, then 50 crores will not even know that they were infected and they will have a normal going. And then another 40% will have mild to moderate symptoms, and then another 10% will have the severe and complicated infections, and say 2% will die. 2% for 100 crores will be like 2 crores. So that's the figure which says. And the objective that we have is to control the outbreak and minimize the death, because 2 crores is a huge number. Now like India shows roughly or approaching 90,000 deaths, maybe 87,000 something and all that. So the epilogue will be medically when the infection doesn't spread. We will definitely like how to stop the infection so that least number of people are affected. So that is how the medical fraternity will think. And socially, people follow the safety protocols and accept the new norms or new normal. COVID-19 has become a new norms, a new lifestyle, where you have all the social distancing, work from home, stay at home, do not go out unnecessarily, and all these luxuries and recreation things that we had of going out, eating out, picnic and this and that, movies and all that are all like stand still. And then wearing mask and hand sanitization and personal hygiene and all that are in play. And then we see a lot of things coming, family together, family who were not having time together, now at least they are there, probably getting bored seeing each other inside the four walls, but that's the new norms. And the government, if you see, like if the government says like they have done what is needful, and beyond this they can't do anything, and the best and all that they have done. So if you see like these three things, then it is probably an assumed solution from medical fraternity, from the society, and of course from the government as well. And then what is the new norms? As I just said, stay at home, proper mask, hand sanitization, plenty of soap and water, sanitizer, no overcrowding, not going into the crowd and where there are too many people. Physical distancing is very, very important. And this COVID-19 is not like flu or common cold. Many people, they say like, okay, ye to common hai, this is very common and this will just go off. So it's not similar to flu or usual viral infection that we get. So it has to be taken very seriously. Don't take it lightly. It is very dangerous. And as I said, like 70% of the population or the infected people will be asymptomatic. But that doesn't mean they are not contagious or infectious. If they transmit the infection to somebody, that doesn't mean that person who is affected by the asymptomatic person will also be asymptomatic. That person may have symptoms, and the symptoms can range from mild, moderate, severe, and complicated. We will come to the symptoms later on as well. So we see like this is how the disease develops, and the incubation period means the person who is exposed to the disease, to the person, by the person who is infected, and to bring symptoms into his or her own body will take nearly 2 to 14 days, averaging about 5 to 7 days. So the incubation period will be say like 2 to 14 days, but 5 to 7 days on an average. You will see like a person who has been exposed to the infection will get affected and shows symptoms. So symptoms range from, the clinical features range from no symptoms, means there's no problem, the virus is there, you may do the test and you will find yourself positive, but then you don't have anything, no problem. So that doesn't give us a green signal to go around and have our normal life, because you will infect others who will become symptomatic. And secondly, that you are required to lock yourself for at least 14 days, and when you become completely negative, then only probably you can go out and mix around with people if necessary. So the mild symptoms will be like common cold, like whatever, a little sore throat and feverish feel and whatever, little. But then it can go up to the severe forms, which is pneumonia and severe acute respiratory syndrome, or ARDS we say, and then the kidney failure, organ failure, death. So this virus actually causes hyperinflammation. So, and the cause of death is due to complications and effects of cytokinin storm syndrome, which I will not go, because I know like most of my viewers are laymen, so I'm trying to put it as simple as possible. If suppose like I was only talking to the doctors and all that, then probably all the health professionals, then probably I would have gone into the pathogenesis of this and many things. So this, how to then improve our immunity? There had been a lot of things, and the market also does good marketing with green tea and this and that, protein and all that. Those are fine, but in a nutshell, like I like to say, like have a nutritious food with pulses, green vegetables, fresh fruits and all that. Multivitamins, of course, is needed to just support our nutrition. And maybe like the zinc is there, it is good. Vitamin C, and take no intoxicated materials, like smoking and tobacco in any form is bad. It's never good. Alcohol and many other things. There are like some pouches, we say here gutka, pan parag or something like that. So not good. So please don't take any sorts of intoxicated materials. And take adequate rest and have a very good sleep. 8 hours, nearly 8 hours for adults, 6 to 8 hours is very, very important. And maintain your personal hygiene, daily bath, daily change of clothes, and hand sanitizations, and even change of bed sheets and towels, and everything will be very important. So general cleanliness is important, and drink lots and lots of hot water. So even now, when I have recovered from COVID, I drink about 4 liters of hot water every day. And when I'm saying hot, means hot, like I'm not saying warm water, I'm saying hot water. So of course, we see when we were seeing the complications also, pneumonia, SARS and ARDS, that is acute respiratory distress syndrome, where the lungs becomes wet, which is also called wet lungs, and there is a severe pulmonary edema. And there are, if you take the X-ray or the CT or maybe ultrasound also, you will see lots of consolidations in the chest, and the oxygen saturation, which when we measure from here with the pulse oximeter, actually it has to be 100%, but normally 98, 99 is always there in anybody and everybody, unless and until they have any disease or something, and that goes down, and that is a very, very important marker to manage accordingly. So we see these are the symptoms. 88% of the affected people will have, those who are symptomatic, will have fever. And there's a dry cough, there is unexplained fatigue and tiredness, weakness, you can say. It's too much, it's too much. And then there's, that is 38%. And then there may be coughing with symptoms, 33%. You can see the figures there. There is loss of smell, loss of taste, diarrhea, vomiting, shortness of breath, muscles and joint pains, sore throat, headache, chills, and you see there may be difficulty in walking, there may be confusion, and you see there may be some bluish face or lips, there may be coughing of blood, there may be persistent chest pain, there may be sweating, there may be red eyes and conjunctivitis. I know one of my friend who had no symptoms other than this, maybe two more, some sore throat and feverish feel, and then red eyes, swollen, and conjunctivitis, that was there. And then very high fever, of course, it may also come. So the investigations needed to confirm this COVID-19 would be like ferritin. Not many are doing, but that is the earliest finding. If you do the test for ferritin, that will show there is a rise, and that is the earliest finding, And then even if we go for TCDC or CBC, we say, and you see the total leukocyte count, the white blood cell count, there is leukopenia and leukocytosis, and then you see the lymphocyte counts coming down, and lymphopenia most common actually, that is 20%, it has to be 20% and above. You will see like it is below 20%, and the range also of the total count is say like from 4,000 to 11,000. So either it will be in the normal or it will be actually towards the lower side of within the normal range, or sometimes it will come below 4,000 cells per mm of count. So you see, we can make out from there also CBC and TCDC, and then we see there's a rise in ESR. That may not be diagnostic because ESR can rise for many reasons, very common reasons and all that, and we see there is a rise for even CRP, that is also suggestive that there are some infections in the body. And we see like these are like ferritin, and then there's a rise in D-dimer, which can be a little more indicative towards the things, and there is a rise in procalcitonin, and that is also quite indicative towards this. And then others are like there's a rise in LDH levels, there's a rise in AST and ALT levels. But the virus is confirmed by RT-PCR technique, where the samples or test materials are taken from the throat. You go either through the nostrils or through mouth also. They take the sample and they do this. And then of course chest x-ray may show the basal pneumonias or some infiltrations or consolidations. CT scan chest, lung ultrasonography will be helpful to again see different lines and consolidations, wet lungs, and these things. And then of course the very much talked about screening was the rapid antigen test kit, which will cost about 450 rupees, and the results are there in 15 minutes. So you just take a blood and put it there like the pregnancy test, and you get the test. But then it has a limitation, and there can be 30 to 40% of wrong reports. So that is not reliable, and for screening it is okay, but once it comes positive means it is most likely you are positive, but then most likely it can give false negative also. So TrueNat is there another which will take about an hour or so, and it will cost about 1300 rupees, and one can get the confirmation through that. And then the recent one that India is talking, just 2 or 3 days back in the newspaper and news it came, FELUDA, I don't know, Feluda test and all that. So this is FNAS9 editor-linked uniform detection assay, and it's a paper-based strip test. So you just do it, and again, like in 30 minutes, the results are out. I'm not sure about the cost also, because they have also not put it. But it's a paper strip, and they will just do the testing, and the 30 minutes the results are there. So this is the treatment. There we have observed that there are so many unnecessary treatment. People are doing everything. They are asymptomatic, means you give whole range of medicines and all that, and that is unnecessary, and because each medicine has a side effect, and over medication is also a problem. Even for vitamins and whatever, that may be a problem, because laymen and others are not really aware of the side effects of over doses of multivitamins and all that also. So the necessary supportive treatment would be primarily supportive, and that is home isolation or quarantine, or maybe like you quarantine yourself in a quarantine, government designated quarantine centers, or sometimes like hospitalization may be also needed as per your symptoms and severity. But the idea is to have complete rest, and continue to have nutritious food and ORS, and you take lots of plenty of fluids, hot soups, beverages and water, and do steam inhalation and gargling. I would suggest that avoid nebulizer and prefer inhaler, because again, like if you compare between the two, the infection retained because of the use of nebulizer will be higher than the use of, in comparison to the use of inhaler. And then keep on monitoring your oxygen saturation if you're there in home also, SpO2 monitoring. And if you see, like as I said, here if you see with the pulse oximeter, it is supposed to be 100% oxygen saturation, but of course 98, 99 are the normal, and below that, like it is has to be seen whether like there is a shortness of breath or breathing difficulty or tiredness and all that. And definitely below 92% is grade 1 respiratory failure for any person, and below 88% is grade 2 respiratory failure, and below that is much more severe, and it has to be immediately dealt. And what medications? Actually, lots of people call my wife or my family members, and they ask about the medications and what to do. There's no specific antiviral drugs or medicines, no? And the prophylaxis with hydroxychloroquine sulfate or chloroquine phosphate is also questionable, debatable. Some good institutions have been recommending it, like the premier institutes of the country, AIIMS and all that. But there are other institutes and all that which say like may not use, because we have not seen a concrete evidence on about the effects of the prophylaxis. So, but then monitor vitals, body temperature, respiratory rate, like how many times you breathe in a minute, and usually it's around 18 to 22 or something like that. So you see like your respiration increases, your respiratory rate, then there's a problem actually. And then of course, as I said, like oxygen saturation, which has to be done by the pulse oximeter. And then the treatment is mainly symptomatic. If you have headache, take medication for headache. If you have diarrhea, correct that with lots of fluids, ORS or lactobacilli, or maybe sometimes if it is very severe and you think like it may be bacterial also, so antibiotics. Otherwise it's a viral diarrhea. You only have to see your vitals, your BP and pulse and respiration, body temperature and all that. Those are maintained. Your hydration, that your tip of the tongue is wet enough, or sometimes you can do it seeing the skin. You pull the skin, and when you leave it, it goes back, means it is normal, but the skin remains like that. That is means you are into moderate to severe dehydration, so dehydration has to be corrected. Otherwise, like, no need to take any specific antibacterials for diarrhea and all that, something like that. And then a lot of supportive treatment, like the food, the water, the laundries, and so many things and all that. So we see some of the antivirals here, remdesivir and lopinavir and ritonavir and favilavir, and then we see interferon, ribavirin, and all these anacarna. These are the medicines, but of course this will not be taken at home, and these are all advised when you're there in the hospital and probably in the severe infection, or maybe in the ICU, or they will use this. And corticosteroids, avoid taking steroids because it may again prolong virus replication. I had to take it because I saw at one time, like my oxygen saturation had come to 84 and something like that. So I just took it for 3 days, and I was again monitoring myself. So I took dexamethasone, Dexona we say. So I took morning, evening for 3 days, and then it was okay. So what to do in home quarantine and isolation and all that. And tablet paracetamol is very important, and people sometimes say like, okay, I don't have fever, so I don't have to take it. Well, paracetamol acts for 3 things. It's antipyretic, means anti-fever, and then for pain, anti-analgesic if there is a pain, and then anti-inflammatory. So when there is an inflammation, if you remember what I said, this virus causes hyperinflammation of the body tissues and all that, especially there in the lungs. So it is very important that paracetamol, even if you are asymptomatic, sometimes it is good to take at least twice daily. And tablet azithromycin 500 mg once daily for 5 days. This has been recommended by all the experts also, just to protect you from the chest infections, secondary infections also of bacterial and all that. And some people, they advise after azithromycin take a course of doxycycline also. So 100 mg twice daily for 5 days, which I took. But this doxycycline is a very, very difficult drug to digest. So I never tolerated. First time in my life, like I had actually tolerated, because anytime in my past, say like even 1 dose will give me lots of abdominal cramps and vomiting, nausea, and different feeling, and not feel good, toxic feeling and all that. So I couldn't take ever like more than 1 dose of doxycycline earlier in my life. And after so many years, probably like 1.5 decades or so, I tried this fearfully. And the key is to take this drug empty stomach, which is like 1 hour before or 2 hours after food. So if you have to eat food, be your breakfast, you take it 1 hour before that with the water and all that. And you have to push the drug into the intestine through the stomach, so that it doesn't remain in the stomach to give you more gastric problems like nausea and vomiting. And then of course, if you have taken food, then wait for 2 hours, and then you take this medicine, and then again wait for an hour to have something. So pantoprazole 40 mg twice daily, dexamethasone I took like 1 mg, or I took 0.5 mg twice daily. So these are all placebos, and those are supportive, not definite thing and all that. You may take, you may not take, but then this is the practice right now, like everyone is taking it. So capsule Zincovid, that is multivitamin with zinc, take twice daily. Tablet vitamin C, take twice or thrice daily. Take vitamin D once daily. Calcium and vitamin D, you can take that. And of course, because there's inflammation, there's a pain in muscles and joints also, and calcium will help. Vitamin D3 will help. Vitamin E once daily or something like that. and take probiotic and lactobacilli because there's inflammation, and then you have taken azithromycin and doxy and all that. So the diarrhea and other gut bacteria can be protected by probiotic and lactobacilli. And some cough syrup like syrup which contains bromohexidine, take twice daily. Cipla makes it, which is called Cofdex, but then I saw like many shops were not having it, so lots of people getting back to me saying that Cofdex is not available. But this is a very nice thing which contains bromohexidine, and one can try with that to relieve the cough. And of course tablet cetirizine and all that, which is antihistamine, and that will might also help. So lots of steam inhalation time and again, gargling time and again, 4 to 6 times a day or so. Hot drinks, as I said, water, soup, red tea, green tea, whatever like that, hot. And I used to drink 5 liters when I was sick from 18th of August till 1st of September. And nutritious diet, easily digestible diet, you can't eat it. I was struggling actually. I'll come back to my sharing my experiences and all that. So this, when you are in the hospital, vitals monitoring of course is very, very important for all the nurses and doctors to do it. See the oxygen saturation, and depending on that, like of course the oxygenation, full flow of oxygen, which is the best management actually, because most of the people, they only need oxygen for some time or some days and they are out of the disease. And then of course the symptomatic disease, as whatever the complaint may be, try to correct the complaints with the supportive management of nursing care, or providing whatever need that they have and all that, a good nursing care. And prone position with people like who have been coughing, or there is a dip in the oxygen saturation, there is chest pain or chest tightness and all that. Sleeping like with your chest down, and back up towards the sky, that is very important. You sleep like this in prone position, that is good, because when you are supine, you will have more problem. Of course, I'm tempted to give reasons, but then like there's a limitations of the time also, so I just want to go ahead. And sometimes rotate the patients also. If suppose like in ICU, the patient is lying upside down, means the chest down on the bed and back towards, facing towards the wall, ceiling, and lateral, left side, right side, and supine means again making the patient sleep straight on the back and something like that. So high flow oxygen therapy is needed when there is a dip in the oxygen saturation, and depending like upon the condition, you give artificial breathing or ventilation, and that is the best is non-invasive ventilation, which we can do with CPAP or BiPAP, and then the invasive ventilation, where you intubate, put the tube inside the trachea and then put it in the ventilator. So that is invasive ventilator. Data have been showing that people who are with non-invasive ventilation, with CPAP, BiPAP and oxygen flow, high flow therapy, they are doing much better. The success rate is 50%. But people who are there in ventilation, in the ventilator, 75% have died actually. So that's sad news. And we all keep on thinking of ventilator. So that depends like when to put the ventilator. Otherwise, like non-invasive ventilation is always preferred. And then this is my experience. Like I got, as you know, like I'm a medical doctor, a family physician, and I'm the medical director of St. Barnabas Hospital. And I got infected in my hospital only, where like this hospital is actually non-COVID hospital, but people come, we try to see if they have had a COVID test for admissions and all that, but sometimes they the results are or the reports are awaited, or they have not done. So we admit them, and we try to keep them in isolation as much as possible. and take precautions. And later, after 2 days, when the report comes, if they are negative, it's fine. If they are positive, it's an alarm, and then we refer them to the centers where COVID patients are treated. So I got infected in the hospital because in our ICU also at different times there were 4 patients, 2 patients, 3 patients and all that, and we were not knowing that they are positive. The results came later and we were handling them. Of course, we had our precautions, but still. Then similarly, it happened in our wards, in my OPD also, like there were a number of patients coming, and every time like I was putting a circle, red circle on that date and writing down like the names of the patients who were positive. And once like I carried one person also on 15th of August who was a senior citizen, extremely tired and all that, and struggling to get into the car from the stretcher and all that, and there were senior citizen ladies only to help him. So I was just crossing. I was not well protected also. It was only my mask and the full sleeves and all that. And then I saw and I knew that person is positive, and then I had to just lift the person and put it in the ambulance and all that. And I knew like my viral load is increasing and probably this is ultimate, because that took some time also to shift him. And I started on the first day like with the tiredness and laziness and all that, and didn't understand. Then the second day I had the sore throat. I was working in the hospital. Then I had feverish feel, and suddenly there was loss of taste and loss of smell the third day. And then I knew like, oh, something is wrong, and then I had to just quarantine myself and lock myself 13 days thereafter in the room. I didn't step out and nobody came in. There was a table laid there where like all my needs were kept there, the food, the hot drinks, the clothes and all that. And I was just inside the 4 walls with the attached bath for 13 days. So that is how I managed myself. I had all these symptoms of fever and didn't feel like eating, and I was not able to eat actually. Just to have 2 slices of bread also, like it took me more than an hour or so, and extreme tiredness. I can't sit like this. It was like just like I was falling off. I was falling off for about 4-5 days like that, 7th day to 12th day, something like that. And I can't even sit and drink water. I can't even take phones. It was that extreme tiredness and weakness and all that. So lying down only I used to eat, and I used to just drink things which will not spill and all that. Somehow like positioning myself lying down only, I could drink also. So that was a very severe time, and of course I was getting a lot of messages, phone calls, which most often like my wife and children were attending it, and lots of prayers, lots of emails and assurances and all that, which kept me going. And I didn't realize like those 13 days being inside the room, suffering with all these complications, could take me out so well, and I'm here. And I frequently monitored my oxygen saturation, and I mainly took paracetamol, azithromycin, doxycycline, probiotic and lactobacilli, pantoprazole, and of course Zincovit and vitamin C, dexamethasone as I said, and cough syrup. But then mainly routinely I took the first 4, that is paracetamol, azithromycin, doxycycline and probiotic, lactobacilli. Rest of the things like it was just off and on once or two thing, and even vitamins I didn't take it like altogether 15 days for twice. Hot drinks, soups, water, red tea, 5 liters a day, and that was very helpful. So as I said, like combating COVID and committing to Christ, actually with the help of Christ. So that helped me a lot. So this is what that was there in my mind. And some of the verses and portions from the Bible I have put here, the Old Testaments. Of course, I would have wished to read all these things for you, and often shared during these days are Psalm 91, anywhere and everywhere, like people are talking on Psalms 91. But the very first phase, it says that there's a use promise there, and he says like all those who dwell with the Lord. So we forget dwelling or being with the Lord, and we try to have all the gains or the prosperity, or say like health or whatever promises from the Lord. But then the first phrase is like it is for the people who dwell with the Lord. So of course there's a whole lot of things here, and I think I've taken much time now. So I would have loved to read some of the verses and portions, but then that's there on your screen. Please do read it. It's the words from the Lord, and it's Christ speaking to us. And if you believe, even if you have to die, you are in gain, and you are not lost. Of course, the loss is there, but then this is the assurance that no one can snatch us from the hands of the Lord. And He promises us health, He promises us life, He promises us abundant life. He is not promising us a lengthy life. So if he knew and He told us that when and how we are going to be born, He says like before the creation He knew us, He saw our unformed bodies. So He knows when and how and where we are going to die. So our days are numbered, whether it is by old age, whether it is by some accidents, whether it is by COVID or some other sickness, whether it is natural or whatever we say, it's all known, and God is sovereign in control. So it's time actually for us to focus on Him, His words, and see what He is saying and how best we can build our relationship with Christ. And this time of crisis, we see lots of online things happening, and lots of cell groups, lots of Bible studies, lots of sharing, lots of webinar, lots of sermons. And even if you have missed, like you can go back to the YouTube and find sermons from different churches, different places, different countries, and that is so encouraging and all that. And for me personally, like I spend time with the Lord, reading the Bible and kneeling down and praying, and that has been my key to combat COVID. And together we can, with the help of the Lord. So primarily, like there's a call from the Lord that come to Him, and then He is going to heal us. And we may not be cured, as I say always, but definitely we will be healed physically, emotionally, mentally, and spiritually. Thank you for bearing with us, bearing with me, and taking this time out for an hour or so. And but I hope like this is helpful. You are most welcome to come back to me through messages or mails or phone calls, and anything that I like to help you anytime, I will do so. And be blessed. Have a nice day ahead. Amen. Let me just pray. Father God, thank you once again for giving us this time to interact with the viewers there, and hope that they were listening and they will be blessed. And I do look forward to help as many people as I can, both in the hospital and outside in the community. I realize that soon after COVID also I have been running around, so many deaths, so many sickness and all that, but give me that energy and all that, and so that I can help people. And let your love, let your word, let your touch them to heal them. In Jesus' name I pray. Amen. Thank you. Thank you.